Excretory system?
So what we're going to do is we are going to just talk about one body system that probably I would guess you're not very familiar with. It's called the lymphatic system. And sometimes this is included as a part of the immune system because it has some immune functions, but it has other things that it does as well. And the lymphatic system is a system of vessels and fluid that runs all throughout our body. You could think of it as being sort of similar to our circulatory system. So our circulatory system pumps blood around our body. Basically, all of our cells are close by blood vessels. Okay? Well, the lymphatic system is also a system of tubes and vessels, but instead of carrying blood, it carries a special type of fluid that we call lymph. Okay? In lymph, it starts off as part of the blood, but when the blood gets to capillaries, some of the liquid part of it gets squeezed out, and then we call it lymph. Okay? It surrounds all of our body tissue, has this lymph surrounding it, so that things can diffuse in and out. It also helps to carry away bacteria and other pathogens. Okay? So the lymphatic system part of our immune system, and it's this system of tubes that carries lymph fluid. It is considered part of the immune system. Sometimes it's treated as a completely separate system, just the lymphatic system, either way. And so this fluid, this lymph, okay, it's important in our body. It's fluid, it circulates around our body, it picks up unneeded materials, picks up dead bacteria or viruses. And then as this lymph fluid is traveling through our lymph vessels, okay, it goes through these little enlargements that we call lymph nodes. Okay? And these lymph nodes are important. Inside of these lymph nodes, there are special cells, white blood cells, which can destroy the bacteria that the lymph is picking up. Okay, those white blood cells that are in the lymph nodes are called lymphocytes. And so if you look at this diagram, these green lines on this diagram represent some of the main lymph vessels that carry this fluid around in the body. And along the way, you see those little dots are the lymph nodes. Okay. Now, if you, let's say, sprain your ankle or something, what happens to it? Right? It hurts, obviously. Swells up, right? That if you sprain something, damage some part of your body, it swells up. And the swelling is caused by the buildup of this lymph fluid. It sort of all collects in the area of the injury as part of your immune response. And that's why it swells up. Okay. Also, you know, if you ever had a cold or something and like your grandmother says, oh, your glands are swollen and feels like the side of your neck, has anyone ever said that?
Why does it have to be our grandparents?
That's just, well, it's because it's like an old wives' tale, I don't know. But did anyone ever hear that saying?
Yeah.
Well, they're not really feeling your glands, because when we say gland, we're often thinking about endocrine glands. And it's not what they're feeling in your neck. What they're actually feeling are your lymph nodes. You have a whole collection of lymph nodes in your neck area and around your head. And when you're sick, they start to swell up. They get larger because they're destroying bacteria. because they're doing their job and helping you to get better. Here's an example. We have all these green dots represent lymph nodes, and there's a whole series of them up in your neck, around your cheek, in your face, some in your chest, there's some in your armpits, some in your legs. But all of these, their job is to, as this lymph is going through the node, filter out and destroy these bacteria.
There's no more tissues.
Okay, so this lymph, like I said, it comes out of capillaries, and then as it moves back through our body, it goes through these lymph nodes. And what you see is there's these white blood cells there. They destroy any pathogens that might be in that lymph tissue. Okay? So we also have other lymphoid organs that do this same sort of job. They have partially an immune response. Okay? They're your tonsils, the back of your throat, adenoids, which are back there as well, the thymus gland, the spleen. These are types of tissue that contain some of these lymph filtering areas. Yes?
Why do people get their tonsils?
Yeah, for example, my daughter, my oldest daughter, she had her tonsils removed when she was like 10 years old. So your tonsils, you can see them sometimes in the back of your throat. They sort of are on each side of the back of your throat. And some people are born with sort of large tonsils, and they trap sometimes bacteria in the back of your throat. Like for Taylor, my daughter, she got strep throat like 5 or 6 times every single winter because her tonsils are really big, and they trap those bacteria in there. And so once they removed them, she stopped getting strep throat, and she hardly ever got it anymore. Also, before they removed her tonsils, she snored really loud. Because they would like fall back, they'd close off her airway, and so you're struggling to get air in. After they remove her tonsils and adenoids, she never snored anymore. The last thing to talk about, there is a disease, okay, called You don't have it. Just tell you about it because it's kind of interesting. There is a disease that affects 120 million people in the world called elephantitis, and it's really a disease of the lymphatic system. Now, we don't really worry about it here in our country, but in certain countries, there are mosquitoes that spread a very small parasitic worm. Okay? And this very small parasitic worm gets into your body through a mosquito bite, and then it moves into your lymphatic system, into these vessels that carry fluid around your body. And it grows, it multiplies, it reproduces, and these worms build up in that lymphatic fluid. And what happens is then it sort of starts clogging up the lymph vessels. Okay? So normally, we have this lymph all around our body, and it's constantly circulating around. So this lymph fluid in our legs gets back up into our circulation, and so that's what happens normally. But once these worms clog up the lymphatic system, that lymph can't return back into circulation, and so it starts to swell up. And usually it's the lower extremities, the feet, okay, and the legs start to swell up because this fluid collects in the feet and legs, and it can't get back up into circulation because the passageway is blocked by these worms. And so those areas start to swell up. The skin starts to become thicker. It leads to an infection, and it can cause swelling and skin problems, so much so that a person can no longer walk, and it swells up to huge proportions sometimes. And it's called elephantitis. So these are a couple pictures of this. So here is a person who has elephantitis. You can see much worse in their much worse in their right leg. Okay, obviously. So what this is all of the body tissues are swelling with this fluid. It's not like a little bubble of fluid. Sometimes you'll say, well, what can't they just like drain it? No, it's not that there's like a big bubble of fluid in their leg. It's just all of their body tissue is becoming inundated with this fluid and it's swelling up very large. So obviously that would be bad. That would be painful, make it more difficult to walk. But this is not the most extreme situation. It can get, this is a person who has, it's affected their left leg, but not their right leg. So you can see their normal right leg, but their left leg is completely swollen to like 4 or 5 times the size of their right leg. So yeah, this person can probably still walk, but you'll see sometimes it gets so bad
Oh my God.
that a person can no longer walk, okay, because of this huge swelling in their lower extremity.
Can we get it out?
No, generally only, I mean, it can, there are cases when it can affect the upper body, but mostly it's the lower body, because again, what's happening is the fluid is like collecting on the lower parts of the body and it can't get back into circulation. And here's really bad case,
Ew.
okay, where, you know, a person's whole
Is it the
leg
foot?
and whole foot. That's the regular foot, and here's all the swollen tissue because of this infection by this worm. Bailey?
Can it happen that bad to both legs?
Yeah, probably can. Yeah. And there's not really great treatments. You know, for a person that has elephantitis like this, they can take anti-parasitic medications that help to kill the parasitic worms that are causing it. There's some other treatments, but there's not really good treatment. The best they do usually is try to prevent people from getting infected. So you remember we talked about malaria, where if you can reduce the number of mosquito bites, you can reduce the incidence of malaria. Well, the same thing is true of this disease. If you could reduce the number of these mosquitoes that carry the parasite, if you can reduce the number of times a person is bitten by mosquitoes, you can start to control this a little bit. But a person in this situation is not really going to get better.
Can they like amputate the leg?
They could, if it gets bad enough, they might amputate those parts if they're not going to be able to return to normal functioning. Yeah, they could. All right, any questions? Yeah.
When you amputate a leg, where does it go?
What do you mean?
Like-
What do they do with the?
Yeah.
They destroy it. They usually do. Yeah. Yeah, they might. And if you ever go to the doctor's office or a hospital, you'll see that there are special like garbage bags in red usually, like, and those are for substances that don't go in like the normal trash, biohazards, bodily fluids, dirty, you know, bandages and things like that. And they have the same sort of situation, or parts that they remove. If you have your appendix removed, again, they probably destroy it one of those ways. Sometimes it's incinerated, sometimes it's not. So
What's incinerated?
burned.
Where do they burn?
Don't they still hurt you?
Probably they ship it to one central place where they just burn it up.
Is that where the people go when they're cremated?
No, it's different, but it's that's called the crematorium. All right. So that's all we need to know about the lymphatic system. Not a whole lot, but we just wanted to mention.
How many more body systems do we have to learn?